In the December holiday season of giving, undocumented immigrants in South Africa are getting the gift of a COVID-19 vaccine. The government, with the help of non-profit groups, is offering the vaccine to the country's estimated 2 million undocumented people in a bid to curb the spread of the virus. Until now, many could not get vaccinated because they did not have the required identification, but that changed after a lobbying effort by non-profit groups. Now, the vaccines are being administered to undocumented persons at places such as this Johannesburg shelter.
Some of our people, they're not necessarily registered, they might be on asylum papers or something, and obviously it's quite difficult to access vaccinations if you're not South African, and there's quite a lot of barriers to that. So we just wanted to try and make an opportunity so it would be easy for people to get access to a vaccination.
Many in this line receiving their first jab are not South African, including Raphael Dube, who is happy to get his shot.
You know what? At the end of the time, we need to be vaccinated.
People living in South Africa must be registered on the electronic vaccination data system to receive a vaccine. The system requires each person to have an identification so that the government can track who was vaccinated, which vaccine each person received, and follow up with the individual if needed. The new program, only at selected sites, allows undocumented people to be given a unique identifier to be vaccinated and tracked for health purposes only. The response, according to Doctors Without Borders, has been positive so far, but authorities need to build more trust before the program can be rolled out on a mass scale.
I think a lot of migrants are afraid of being exposed. They're afraid that if they go out to go and get vaccinated, then they might become subject to law enforcement. They're also worried about their information being shared with Department of Home Affairs. So as far as possible, we're hoping that the Department of Health can institute a process that, of course, achieves the legitimate public health goals that they are trying to pursue, but also that protects the anonymity of migrants, and that vaccination should not be an excuse for Department of Home Affairs to unduly crack down on migrants.
UN agencies report 1 billion people are on the move because of conflict, violence, and climate change. Officials say governments and aid groups must work together to ensure everyone has access to the vaccine to help bring the pandemic to a close. Zeri Kassim for VOA News, Johannesburg.